I am not going to get my flu shots. I am not going to get my flu shot. That's why patients are yelling and every one of them telling me not going to get my flu shot. Sitting in my clinic and waiting for patients. I probably shouldn't say this because hey, this will come off as brazen. But every single year I still find it amazing that my patients believe that I tried to deceive and it's raising my doubts in primary care. But I care primarily. If I take care of patients, they'll also take care of me. To work as a community, create herd immunity. But every single year, some resist with impunity. I ask why, cause I wish I knew, but I don't have a clue. My patients try to prove the shot gives them the flu. That's not true, so in lieu of starting a debate, it's my job as their PCP to educate. I am the PRIMARY. Get me? Let me tell you why. I'm here to give you information, gotta let me try. I am meant to prevent disease in those who could die. I exemplify the very type of guy that you can trust, so it's a must that we immunize. I am here to help. I hope you realize this mask is for protection, it is not a disguise. I emphasize, he says, we take your side. I understand your concerns and I empathize, but I still recommend that you do as I advise. But to no surprise, still hear the cries. I am not going to get my flu shot. I am not going to get my flu shot. That's what my patients are yelling, every one of them telling me I'm not going to get my flu shot. I am not going to get my flu shot. I am not going to get my flu shot. That's what my patients are yelling and every one of them telling me I'm not going to get my flu shot. It's time to get your shot. I dream of lowering the risk of infection. The easiest way would be to get an injection for my protection. Or how you say protection may not be mandatory, but still my selection to get my shot. You know, I'm a fourth year medical student, and even I know that the flu shot is prudent. So I'm gonna be an advocate for getting vaccinated. I'm not gonna debate it, the arguments are outdated. I'm gonna get my shot. The freedom of choice isn't really free when your choice can affect him or her or you and me. You and I, do or die. I say that I'm sure that an ounce of prevention's worth a pound of cure. I'm gonna get my shot. My friends, you know I agree with you, but I want your patients to keep on seeing you. So if I were you, I'd be a little more sensitive. Whenever a patient is feeling a bit tentative, they'll refuse a shot. Hey Kerr, I know you agree, and everything you're saying still speaks to me. But I think we've got to see that with advocacy, we can educate our patients so that logically, the odds of infections increase tremendously. But sometimes common knowledge doesn't come quite so commonly. So if it's not common, sometimes we've got to go so far as to let the physician know where the syringes are. Or am I causing a scene? Sometimes when I'm explaining what I think and I mean, please just room the patients. I promise to be done by 5:15. Let's help everyone get a vaccine. I am not going to get my flu shot. I am not going to get my flu shot. That's what my patients are yelling and every one of them telling me not going to get my flu shot. I am not going to get my flu shot. I am not going to get my flu shot. That's what my patients are yelling and every one of them telling me not going to get my flu shot.
Everybody say whoa, 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 hey, whoa, whoa. Say let them hear you. Let's go. I said shout it to the rooftop. Sit to the rooftop. Come on.
Time to sign up. We're gonna ease the disease, just sign up. Tell your brother that he's gotta sign up. Tell your sister that she's gotta sign up. Time to ease the disease, just sign up. Time to ease the disease, just sign up. We're gonna ease the disease, just sign up. There's a brand new disease about to rise up, rise up. I imagine death is running rampant with the impatience. I ask with impatience, what is this new virus that we're facing? If I see it coming, will I run away racing? If I look over my shoulder, will I see it chasing me? I never thought I'd see this in 2020. When I ask for a cure, I know there isn't any. Ask anybody why we try to fight it. We stand united, and then we sit and we breathe for a moment, and that's plenty. Scratch that, this is not a moment, it's the movement. Where all the young doctors with something left to prove went opposed to COVID. Where is the dividing line? Shows that those of us who are the fighting line. And if we could get a vaccination, is that a guarantee of immunity for this nation? Or will the virus learn to fight us with mutation, eventually lead to all the death counts raising? I know that when I fight it, I want to win it, but now I'm sitting here in it, and I may have reached my limit. We have to stop the virus at its source, or will we be forced to let the virus run its course? I pass patiently waiting for a vaccination, actively hoping every day for its creation. And then I hear a cheer, and it's from the nursing station. The answer to all my sorrow, the vaccine is arriving tomorrow. I'm not going to miss this new shot. I am not going to miss this new shot. There's a new vaccine and it's for COVID-19, and I'm not going to miss this new shot. I am not going to miss this new shot. I am not going to miss this new shot. There's a new vaccine and it's for COVID-19, and I'm not gonna miss this new, 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 not gonna, and I'm not gonna miss this new, not gonna miss this new, not gonna miss this new shot.